Hi there, ladies and gentlemen. My name is Bryan Conley, and over the next 10 to 12 minutes, I'm going to introduce you to a company called MD PLUS. We're a concierge telemedicine company located in the state of Florida. What is telemedicine? It basically gives you the ability to get a hold of a physician on the phone that can diagnose you and even write prescriptions and call them into a pharmacy close to where you live. Let's talk a little bit about the healthcare cost here in the United States first. The healthcare cost is a growing issue. It's currently a $2.7 trillion industry in the United States, looking to go to $4.5 trillion over the next 5 to 6 years. And if not addressed now, the estimates are that it could reach $16 trillion by 2025. Now, there are some industries that kind of control the healthcare, and they're the insurance industry, the big pharmaceutical companies, trial lawyers, the U.S. government, the American Hospital Association, and the American Medical Association. Unfortunately, these industries do not have our best interest at heart to keep the cost down because they get a bigger piece of the pie the bigger the healthcare cost becomes in the United States. We're in a big dilemma right now. There's over 50 million Americans that don't have any health insurance, including the vast majority of self-employed Americans. Many Americans with insurance are underinsured. They're paying high deductibles. About 62% of all bankruptcies are due to overwhelming medical bills, and 70% of those people actually have insurance. So all Americans are facing three major issues when it comes to U.S. healthcare. It's access, cost, and quality. The reality is we have a severe shortage of primary care physicians in the United States today. Currently about 25,000 short, estimated to go well over 100,000 short by 2020. There's a severe shortage of ER physicians, and actually 1 in 4 emergency rooms have actually closed over the last 10 years. People are using the emergency room as their primary care physician. In the middle of the night, on a weekend, if they get sick, they can't call their doctor, so they go to the emergency room. And there's a lot of people sitting in the emergency room right now that are not there for a medical emergency. They just do not have access to get a hold of a doctor. There's a big issue when it comes to excessive delays of care in the U.S. Right now, it's an average of 22 days just to get an appointment with a primary care physician. That's if you have insurance. Well, as the healthcare cost and the issue gets worse, that is only going to get larger and larger and larger. So it's real easy to see the need for telemedicine. What would you do in the middle of the night if you or one of your loved ones got sick? Would you ignore the problem and hope it gets better? Probably not. Would you try a home remedy? It might work, maybe it won't. Would you end up in the emergency room? Probably so. Most people end up in the emergency room because they don't have access to get to a doctor. Maybe you can wait till the next day. If you have insurance, call your doctor and try to get an appointment at an already overbooked doctor's office. I know that's happened to me before. They say, come on in, Brian. We'll squeeze you in. Well, that's another way of saying bring your lunch because you're going to be there for 4 or 5 hours because they're already booked. They're just going to try to squeeze you in somewhere. If I'm sick, I don't want to go through all that. Maybe you'll take the day off of work and have your child miss school so that you can go to the walk-in clinic and pay full price. And what happens when you're on vacation and you get sick? Your doctor cannot write prescriptions across state lines, so you're going to end up right there at the emergency room. We're on a mission here at MD PLUS to provide concierge telemedicine to everyone. We provide affordable access to quality health care. We offer 3 plans, which I'm getting ready to go over, that allow you to call a licensed physician 24/7 and get medical questions answered, maybe get concerns answered, even get a prescription called into a local pharmacy of your choice. And when you go pick up your prescription, you're going to receive up to 75% off of the medication by using a discount prescription card, which comes free with every member of MD PLUS. Now, this is not insurance. This is assurance that you can get the access to a doctor that you need and get the medications that you need 24/7. A little bit about our company. We're almost 8 years old. We're based in Tampa, Florida, and we've established a network of over 3 million plus customers all around the United States and Puerto Rico. And over 90% of the members that have actually used our service are still on our service today. Why? Because it's affordable and because it works. We are a debt-free company located right here in this building in Tampa, Florida. Let's go over the plans real quickly. Our first plan is our basic plan. It's $19.95 per month. That's not per person, ladies and gentlemen. This covers your entire household for the same $19.95. We call it our Doctor on Demand service. You get an unlimited advice from our medical team. That includes pediatricians, naturopathic doctors, and board-certified physicians. You pick up the phone, you call the 1-800 number, you're going to speak to a registered nurse who will ask you some simple medical questions. No different than when you go to the doctor's office and they hand you a clipboard to fill out the information. We're going to find out what's going on, why are you calling? I have a sore throat, runny nose, something like that. At that point, your symptoms and all your information will go into a HIPAA-compliant file online. It's your information. We do not share it with anyone else. At that point, the nurse will ask if you would like to speak to a physician. You say yes. They will call you back within about 25 to 30 minutes on average, and the doctor at that point will be looking at your information online. They will be able to diagnose you and even call in a prescription to a pharmacy close to where you live. Like I said, all of this for $19.95 a month. We also get life events counseling with every membership. There's a lot of issues in the world today when it comes to bankruptcy and foreclosure and divorce and addiction and you name it. Sometimes people feel more comfortable speaking with someone that they don't know, so you do have access 24/7 to life events counseling with every membership. This is our basic plan, $19.95 per month, covering everybody in your household. When you join our service, within a day or two, you'll receive a welcome call welcoming you to MD Plus. They want to ask how many people live at your house, what are the names, and at that point you can give them your medical history. That way they have it on file, so when you do get sick, you just can call and speak to a doctor and not have to go through all the medical history at that time. Our goal is for you to get help with MD Plus, get advice from our medical team, get diagnosed, and get prescriptions if needed, because we want you to get better. And oh yeah, the follow-up call. After you use our service, within a day or two, you're going to receive a call from the nurse that you spoke to or even the doctor that you spoke to, just to find out if the medication they gave you, if they gave you medication, did it work? Are you feeling better? What's going on? Is there anything else that we can help you with? I don't know about you, but I can't remember the last time I received a call from a doctor after I left the doctor's office, unless there was something wrong with my insurance and they needed money. Here's a picture of our discount prescription card. It's accepted at over 60,000 pharmacies nationwide. And what makes these cards unique, ladies and gentlemen, is the BIN number. You can go online right now and you can find a bunch of discount prescription cards. This is nothing new. But the BIN number tracks the card. It depends on how many times it was used and how old the card is. That's how you figure out what the discount is. Our BIN number that we use through MD Plus, we actually purchased from United Healthcare for millions of dollars. It's close to 30 years old, ladies and gentlemen. The bottom line is there are true discounts with this card. And this prescription card is free with all memberships. Our second plan is our ultimate plan. It's $49.90 per month. Again, it covers your entire family. You get everything that the basic plan has. The telemedicine, the life events counseling, the discount card, but you also have access to 500,000 doctors and health professionals within the Optum Health Allies group. It's a United Healthcare Group company. Basically, if you need to talk to a dentist, or you need a chiropractor, or you need x-rays or MRIs, you call our 1-800 number, you hit the link that will take you to the Optum Health Allies. At that point, you tell them, for example, I need a dentist. They will search your zip code and give you a list of all the dentists that are in your area. At that point, they will give you a confirmation number, which will ensure your discount between 10 to 60% off of regular price by using the MD Plus. And you can either book the appointment yourself or MD Plus will book the appointment for you. This is a true concierge service. So if somebody has no medical coverage at all, this absolutely is the plan that you want to be on. bare minimum. Now, with the $49.90 plan, the ultimate plan, and the basic plan, in the event that the doctor writes you a prescription, there's a $35 consultation charge. No different than you going to your doctor's office and paying a copay. A lot of times they don't write prescriptions. Over half the time our service is used, it's for medical advice, rashes, things like that. But if they physically write you a prescription on the basic plan or the $49.90 plan, you're going to be charged a $35 consultation fee. That's why most people take the VIP plan. This is by far our best plan. Look at the first line, 0 fee consultations. That means you can call a doctor 5 times a day. If they write you a prescription every time, you never pay the $35 consultation fee. You only pay for the medication when you pick it up at the pharmacy, and then you get a discount on that too. You get identity theft free with the VIP plan. Free and discounted legal services, tax advice and preparation services. You get the ability to do a living will. And I want to focus on the patient's advocacy as we finish up the presentation today. Patient's Advocacy Protection Program. What that means is you have the ability of taking a hospital bill or a doctor's bill that you owe, if it's over $500 and it's been in the last 6 months, and you can turn that bill over to MD Plus. They will become your advocate and call the hospital, for example, on your behalf and say, hi, I'm calling on behalf of Bryan Conley. I'm going to be going over his bill. Please do not call Bryan again. And I'm out of the loop at that point. They're going to go through my bill line by line, item by item, and just ensure that the hospital charged me for what they were supposed to charge me. Sometimes there are mistakes made and you get overcharged. It does happen. They will go through your bill line by line, and then at that point, when they get the bill straight, they will negotiate your bill down. We have an average of 70% discount off of your bill through Patients Advocacy. I know a customer who had a $5,000 bill for 3 hours in a local emergency room with no insurance. 3 hours, no insurance, it was $5,000. When they turned their bill over to the Patients Advocacy Department, their bill went from $5,000 to $1,290. Ladies and gentlemen, that's a big, big discount right there. So that is our $99 plan. We have 3 plans, very, very easy to understand. You have a $19.95 plan, you have the $49.90 plan, and the VIP plan. You choose the plan that's best for your family, and you can enroll today. Very, very instant access. When you sign up for the service, you're going to have access immediately, and there are no contracts with MD Plus at all. You can start with the $19.95 plan. If you find out you need a dentist, for example, upgrade to the ultimate plan. When you go have your dentist appointment, everything's done, you can go back down to the basic plan. We don't care which plan that you're on. We're not the police trying to make sure you stay on one plan. There's no termination fees with MD Plus. It's a pay-as-you-go service. So I just wanted to introduce you to MD Plus. We're a telemedicine company. It's the hottest trend in healthcare today. Please get back to the person that invited you to take a look at this presentation. Pick the package that works for you and your family and enroll today. Have a fantastic day.